Hello, my name is Rhonda Dickman. I'm a registered nurse and clinical quality improvement specialist with Tennessee Hospital Association. I lead THA's efforts to support hospitals in reducing sepsis mortality. In this issue of Sepsis Journal Club, we'll be asking the question, could taking probiotics help prevent and treat sepsis? The article we're reviewing is entitled Therapeutic Potential of the Gut Microbiota in the Prevention and Treatment of Sepsis. This article was published in Frontiers in Immunology in September 2018. It is cited here for your reference and is available as a free full text on PubMed. The authors introduced this interesting topic by describing sepsis as complex and multifaceted. They state that patients with sepsis suffer both sustained excessive inflammation and immune suppression, and that treatments for those targeting those areas has not been successful. New tools in the treatment of sepsis are needed. They also state that tremendous strides have been made in understanding the pervasive role of the gut microbiota in host immunity. Disruption of the gut microbiota leads to increased susceptibility of sepsis. And a handful of pioneering studies have shown that the composition of the intestinal microbiota is severely affected by sepsis. So in this review, the authors aim to provide an overview of the mechanisms through which the microbiota contributes to host defense in sepsis, and they propose a couple of possible therapeutics. Intestinal microbial communities are involved in a wide array of functions, including digestion of food, production of hormones, development and maturation of the immune system, and protection against pathogens, both through enteric and systemic processes. The microbiota provides protection against enteric pathogens by outcompeting pathogens for nutrients, producing antibacterial peptides, modifying bile salts to render them harmful to other microorganisms, driving mucus production and intestinal epithelial integrity, inducing production of antibacterial factors by epithelial cells, and enhancing the humoral responses against invading pathogens. At the systemic level, the gut microbiota is linked to inflammatory cytokine production capacity. In mice models, gut organ axes have been discovered in which microbe-assisted molecular patterns and microbiota-derived metabolites translocate from the gut into the systemic circulation, where they cause immune cells to enhance regulatory or pro-inflammatory responses. In this way, intestinal bacteria can direct the influx of immune effector cells into distant organs. And the authors give these examples. Systemic exposure of microbiota-derived ligands increases the activity of alveolar macrophages against pathogens in the lung. Short-chain fatty acid products of fiber fermentation by gut bacteria possess strong immunomodulatory properties. Desamonotiricine, a degradation product of flavonoids, increases survival in mice infected with influenza by augmenting type 1 interferon signaling. The presence of microbiota-derived lipopolysaccharides leads to increased recruitment of bone marrow-derived neutrophils, which enhances clearance of bloodborne pathogens. And the outer membrane components of gram-negative bacteria in the gut protect against sepsis by modulating serum levels of IgG and IgM. Patients with sepsis have a profoundly distorted intestinal microbiota. The diversity of the microbiota decreases rapidly upon hospital admission and becomes more pronounced in later states of hospitalization. And the authors say this is partly explained by clinical interventions such as enteral feedings, mechanical ventilation, the use of proton pump inhibitors, opioids, vasopressors, and of course antibiotics. And also by sepsis-related impairment of gastric motility and intestinal epithelial integrity, which reduce beneficial anaerobic bacterial families and allow for expansion and translocation of opportunistic aerobic pathogens. This systemic translocation of the opportunistic gut bacteria increase the risk of organ failure, and the authors give these examples. The severity of acute kidney injury during sepsis can be ameliorated by administration of 3 short-chain fatty acids, acetate, propionate, and butyrate. Translocation of intestinal bacteria seems to be associated with the development of ARDS, And bacterial translocation may also be associated with acute neuroinflammation in sepsis. Extreme shifts in microbiota composition observed in sepsis patients potentially contributes then to worse outcomes. And the authors state that further studies are needed that confirm that disturbances of the microbiota truly contribute to organ failure and are not merely a reflection of the profound dysregulation present during sepsis. Harnessing the immunomodulatory properties of the microbiota could possibly provide an attractive preventive and therapeutic opportunity for sepsis. And this could be done by resupplying the pool of beneficial microbes through administration of probiotics, improving the intestinal microenvironment through dietary interventions and prebiotics, or recolonizing the gut through fecal microbiota transplantation. The authors suggest 3 possible therapeutic approaches to preventing and managing sepsis. First, a targeted microbiota modulation for at-risk patients prior to sepsis development. Second, addressing dysbiosis during the course of sepsis. And third, rapid microbiota restoration in sepsis survivors. The authors provide this interesting context in considering modulation prior to sepsis. Patients undergoing allogeneic hematopoietic stem cell transplantation who develop antibiotic-induced dysbiosis have a 5 to 9-fold increased risk of bloodstream infection and sepsis. In elderly patients, dysbiosis was associated with a 3-fold increased incidence of subsequent hospitalization for sepsis. Exposure to longer duration of antibiotics, different classes of antibiotics, and broader spectrum antibiotics during hospitalization increase the risk for sepsis. Meta-analyses suggest that probiotics are safe and effective at preventing infection in post-op and mechanically ventilated patients. In a large study in rural India of healthy-term infants, administration of an oral symbiotic preparation reduced the risk for lower respiratory infections, sepsis, and death. So the authors conclude there is a potential value in targeted microbiota restoration to decrease the incidence of sepsis, and go on to say that large stratified cohort studies are needed. During sepsis, implementation of probiotics has been limited due to lack of consensus as to the optimal choice of probiotic species and dosages, along with lingering concerns for patient safety. Fecal microbiota transplantation has been successfully used in 4 cases of therapy-resistant sepsis and diarrhea. And the authors state that recolonization could counterbalance dysbiosis, induce recovery of the gut microbial barrier, and potentially improve patient outcomes. Treatment with microbiota-targeted metabolites, such as butyrate or other short-chain fatty acids, could be used as immunomodulators. And again, more studies are needed. Following sepsis, immunosuppression can be maintained long after recovery. Sepsis survivors are predisposed to infections and increased mortality up to 2 years following discharge from the hospital for sepsis. The dysregulation that occurs with sepsis is profound and long-lasting. So the authors propose that targeted interventions could be designed to reverse the immunosuppression and decrease mortality. Microbiota restoration, whether through probiotic administration or fecal microbiota transplantation, warrant further study. So as the authors look to the road ahead, they state our understanding on how disturbances of the microbiota can predispose or perpetuate the dysregulated immune response with sepsis is fragmented. Large human cohort studies that document microbiota composition prior to, during, and after an episode of sepsis are needed. But further implementation of microbiota-targeted therapies could possibly improve sepsis prevention, management, and outcomes. As a reminder, this interesting article is available as a full free text on PubMed.